I, of course, have put a lot of my own personal photographs into the session so that when I watch Transcending Trauma, my identity and ego and prefrontal cortex, it's almost like there's a beautiful string theory, but there's this interwoven integration between me and the messages, so that somehow my other than consciousness thinks it's about me, for me, through me, in my benefit or advantage. Do you think that there is actually a benefit to making sure that you see photographs of yourself within the content? And if so, why?
Because if you don't, it's this external thing. This is the pathway to internalize what you're getting. And especially if someone has images of, okay, trying to remember when I was happier or when I was thinner, or pre-trauma self, that you're who you are before that thing happened, or in spite of it, or better because of it. And so it makes it more possible when it is something that you more strongly, your brain grabs onto. It's more familiar, your own face, and people around you that you care about. And how do you not feel happy looking at, your cute pet or whatever? But it stimulates the brain in a positive way, and it makes it more familiar and therefore more possible. And especially with trauma, we're looking to strengthen hope. We're looking to strengthen the sense of possibility. Like if you've been through something so horrific that there's no, your brain, one of the things with trauma is it is so emotionally disturbing because there's no familiar place to file what just happened, right? What you've just been through. And so it takes a while for your brain to decide, okay, I'm going to build a place to put this thing. And so when you start to grab, what's more familiar and safe and positive that you can really attach yourself to, it's going to be more powerful, because there can be a tendency in that negative thinking that I talked about earlier to just kind of keep it all external, and that's for somebody else, and I can't relate to these positive images and these beautiful souls and their joy, and because my life has been destroyed. And so bringing the possibility back of you're still who you are before that, or that connecting it. I mean, I think it was pretty creative with you inserting your face to things that you aspire to. And that might be a good pathway to try as well, of if the hope is there. I think it has to be realistic and something that someone can grasp. And again, in a clinical setting is a little different. I think this would be used a little differently than like business. But I do think that mirror neuron, that important piece of making it relatable and applicable to your own life, becomes so much stronger when you have your own images in there.
Yeah, well, thank you.
Yeah.
I love that perspective, actually. I really appreciate that. There are some other questions that people often ask, and I would love to hear your answer to it. Should I watch it fast or should I watch it slow? So what do you feel when you watch sessions, Diane?
So I think this is quite a variable kind of answer, and like in a clinical setting, I'm always asking if people have any kind of seizure background or flashbacks in trauma, and trying to assess their comfort zone and introducing it in small steps. And so only introducing, like watching it for 30 seconds or a minute at a very slow speed, and then talking about it. So how I would introduce it in a clinical setting is not at all how I would be using it as a consumer myself. And there are some days where I need my hit of positivity, and I got to get onto a meeting, so I'm faster because I want to get my 3 minutes in and get my dose, and that kind of thing. And then there's some days where I just want to savor it, and if I've got the time, I'm just gonna float in it. And so with some former clients I've had who, for example, I was using it with someone who had some attention deficit issues, and the faster speeds were better, and kept them, more engaged. Whereas for some other clients, like, no, I really want to mentally chew this, and really get in there and absorb it. So personal comfort, clinical appropriateness. And so there's a lot of different ways to use it in a good way. And, I think I may have asked you about this, and I don't know if it's applicable yet because I haven't tried it, but being able, like, there are some of the key, like the original happy tune, music. Like, it'd be great if somebody could have, play which of, maybe 3 different settings of, one. The original one for Transcending Trauma was very soothing, calm, spa, gentle and gorgeous. And then there's, very happy, energetic, motivating, and then, something that's sort of mid-range, which I think is, what's on there now, because I wanted to up the energy level of it, because transcending trauma is work. You can't soothe, spa your way into it. Is not going to happen. So there has to be a little bit of a balance, but it's also a very gentle, careful process that needs care. And so hopefully the music there strikes the right balance. But I think the more features, as you continue to build this, the more tailoring people can do. I think, like, their personal images, like you're saying, the more they engage with it and the more they're going to get with it. But again, more research. This is growing, and I'm just so excited for all the promise that this has.
I love